Shifting gears a little bit about um, older immigrants and seniors immigrants, and the research is showing that they have a greater risk, and there are certain issues that they have that are unique to them because they're coming to countries from a different country, their country of origins. They're coming with their culture, and because of the culture that they have, it could potentially impact their understanding of mental health, their inability to talk about mental health or even acknowledge it, and also to avoid services. So certain cultures, there isn't the kind of openness that we see now in, for example, in Canada, where the Let's Talk movement and where it's more open to discuss your mental health. So in many cases, they don't seek mental mental health help, even from family members or friends, not even services, right? I do want to point out a couple of items that they've shown were the greater risk. So I'm pulling this information from a research article. The article is cited here. What they're saying is that for a lot of the Asian cultures, as this was primarily a study on the Asian community, so China, India, and Tamil, other communities, so primarily Asian, they studied a bit the European countries, but because of the Asian culture, they've noticed that there's a lot of pressure in that culture on the female, on the mother, in having to take care of so many different things. And single females who are kind of older adults are showing to have a greater risk of mental health issues and problems because of all the stress and the pressures of their culture. They're also showing that for these females, if there's also a kind of forced financial and emotional dependency on them from their family unit, that can also lead to mental distress. Another issue with immigrants is, like I mentioned, is there are barriers to them accessing services. So many of them, I've listed a few here, but there's limited in their knowledge about what services, what's available for them. There are language and communication issues. So they're not able to communicate with health professionals or even family members exactly what their problem is. There are also financial difficulties that block them from getting help. There's social isolation. There is a mistrust as well of mental health professionals, and they are subject to racism, and there is definitely an impact in racism and in how they are treated. So this is a little bit of a side, but I wanted to bring this into a spotlight, given that many of us are from immigrant families, and this is definitely a challenge and something that we should be aware of. This slide will be posted for future reference, so I put the article link and the title so that people can access it. I'd like to talk a little bit now about the current situation we're in with the COVID pandemic. So the research and everything that I've talked about previously was based on the pre-pandemic, pre-COVID-19. So I thought it would be kind of unfair and not seeing the full picture if I didn't talk about the current situation with the COVID pandemic. In this chart here, I wanted to bring forward a research that was done in the United States. It was done by the Oxford Health Research Center. And what they did is they studied COVID-19 survivors and studied their mental health while they were going through the recovery with COVID. And what they did here is they combined the study of their mental health with COVID-19, comparing it to influenza. So the first row going across here is looking at different disorders. So a psychiatric illness, a mood disorder, or an anxiety disorder. And what they're trying to understand here is comparing to someone who has the influenza and comparing to someone who has the COVID, are there greater occurrences of mental health issues, be it psychiatric illness, mood disorder, or anxiety disorder. And you can see this by the red line here going across. So the red line represents COVID. The blue line here represents the influenza. And the red line is above and sometimes quite drastically, which is showing that with COVID-19 and the survivors who are going through recovery, they have definitely more mental health issues because of COVID. And in this bottom chart here, the bottom three, this shows the comparing COVID to other respiratory tract infections. And again, in all three cases for psychiatric illness, mood disorder, and anxiety disorder, there is an showing here that COVID-19 has an increase. The research paper itself doesn't know at this point in time, they cannot say definitively if this is because of the actual COVID-19 virus that is causing the mental health issues or the situation around the pandemic. As you all know, in many countries, there's lockdowns, many people can't visit their family members. So there's all this stress and mental anxiety. So it's not known at this point in time whether the increase in mental health issues of these COVID-19 survivors and people who are recovering is because of the virus itself, or it's actually just the situation that we're all going through. And a summary now of what they found in this article is that COVID survivors ultimately have a higher chance of developing mental disorders in the early stages of recovery. Some of the statistics here, just for more your information, is nearly 1 in 5 patients were diagnosed with a psychiatric disorder once they were diagnosed with COVID, and there's a certain time frame there. The interesting thing is that many of them did not have a history of mental health illness. So this is something that new that came about that wasn't part of their medical history. This was a larger study. It was 69 million patients. It was a study over 62,000 plus patients who were diagnosed with COVID. The average here is 49 years old, so I know it's a little bit younger than the seniors target area that we're discussing, but it did show, they did study seniors, and it did show that this is having an impact on them. And I put the article here and the link for those who are interested. After the presentation, you can find the information. So for this, I wanted to focus more on those who are diagnosed. We also know we're all experiencing kind of the stress and the mental anxiety of the COVID-19 pandemic and situation with family members and potentially friends or people we know with the virus or affected by the virus one way or another. But my focus on this is more about the actual scientific research